And the new data tonight, the virus not just attacking the lungs, but the kidneys and the heart, what we now know. And news tonight, the first deaths here in the U.S. were weeks earlier than first thought. What we've learned about those cases and where. And the reality tonight inside hospitals across this country. The startling images just outside New York City, the emergency room filled. Even as authorities say we're past the peak, doctors and nurses there trying to revive patients. In New York, 474 lives lost in just the past 24 hours. And tonight, the next chapter of this, Governor Cuomo and his call tonight for a contact tracing army. Thousands of people who will help trace any signs of a second outbreak. Also tonight, some states starting to reopen without meeting the guidelines from the White House. In Georgia, where gyms, hair salons, and bowling alleys are set to open Friday, restaurants next week. The mayor of Atlanta tonight saying there is nothing essential about going to a bowling alley in the middle of a pandemic. The developing headline at this hour involving a doctor at the Department of Health and Human Services. That doctor, a federal worker, helping to lead the fight at the agency in charge of developing a COVID-19 vaccine. Tonight, he says he was removed from his post because he spoke up about drugs not backed by science, including hydroxychloroquine, the drug repeatedly promoted by President Trump. Did he lose his job after speaking out? The long lines for food in this country, the airport in Pittsburgh tonight transformed, in Ohio and in Florida too. And the new concern, 54 million Americans could go hungry, including 18 million children. As another major meat processing plant, this time in Iowa, suspends operations, nearly 200 sickened. And we continue to follow the food farmers are being forced to destroy. Tonight, news on some of that produce and where it's now going. And we have reported so much here on the lungs tonight, the new data on who this virus targets, who is most vulnerable, the dangers to kidneys and the heart, and the factors that put you most at risk. And we do have news tonight on 2 pets that have tested positive for the virus here in the U.S.
This is ABC World News Tonight with David Muir.
Good evening. It is great to have you with us here on a Wednesday night amid the growing debate over the dangers of reopening parts of this country too early. Come new headlines tonight. It does now appear that coronavirus killed at least 2 Americans some 3 weeks earlier than that first reported case in the U.S. And tonight here, the new data just out on who is most vulnerable. We've reported so much on the lungs this week, on the heart, now kidneys and other parts of the body being targeted. President Trump speaking just moments ago as the death toll mounts. More than 46,000 lives lost in the U.S. And with so much talk about reaching a plateau in New York, the reality for doctors and nurses still working so hard on the front lines, this ER overflowing, the medical team racing to revive patients. Governor Cuomo on all of this talk of reopening saying today, quote, "This is no time to act stupidly." New Jersey's death toll tonight topping 5,000. Massachusetts surging past 2,000, nearly doubling in just a week. And again, the long lines for food. The Pittsburgh airport right there. And in Florida tonight, news of one veteran, a father, waiting in line for hours, only to learn there was no food left. He got into a second line and learned the same thing again. Tonight, here are some of the ways Americans can help. And that headline, as we come on the air this evening, the doctor at the Department of Health and Human Services, part of the team working to get a vaccine, saying he's been removed from his post after speaking out. We will guide you through it all again tonight. Whit Johnson leads us off from New York.
Tonight, even as New York descends from its peak, the number of patients flooding the hospitals is still shockingly high. Overnight, more than 1,300 new admissions. A tough week in the ER. The Associated Press given access to St. Joseph's Medical Center in Yonkers. A nurse frantically pumping a man's chest.
Up, low, clear.
The medical team in full protective gear, standing back, arms up, until that jolt to the man's heart. He's revived and put on a ventilator.
We do this all day, every day for the last month. We do this team does this multiple times a day.
Dr. Anthony Leno says it's a daily struggle between life and death.
It's been a nightmare. We have a volume of sick people like you can't believe. In one shift, I pronounced 6 people dead.
New York hit the hardest of any state, but finally coming down the mountain.
We're in a relatively good place. Better to be going down than to be going up.
In Manhattan, police officers cheering for a stream of volunteer health workers from other states now heading home. Governor Cuomo announcing he's now building another army, joining with the governors of New Jersey and Connecticut to hire so-called contact tracers, disease detectives to track down and isolate people who test positive for COVID-19.
We will literally need thousands. We have to put together a significant operation because the numbers get very big very quickly here.
Tonight, in 3 southern states, a roaring debate about whether plans to reopen are moving too fast. In Georgia, where places like gyms and bowling alleys could open their doors on Friday, some big city mayors are pushing back.
There's nothing essential about going to a bowling alley in the middle of a pandemic.
Governor Brian Kemp defending his plan.
And listen, if people don't want to go, Martha, they don't have to.
Dr. Deborah Birx of the Coronavirus Task Force in the uncomfortable position of answering questions about whether Georgia's plan makes sense.
So if there's a way that people can social distance and do those things, then they can do those things. I don't know how, but people are very creative.
Hard choices for Atlanta barbershop owner John Douglas, who's decided he's not ready to reopen.
I was excited, but then I had to just sit back, calm down, relax, and just realize that it's probably not the right time.
Ford Fry is eager to get his 12 Atlanta restaurants back in business, but says the risk is too high.
The climate was that no one's ready to go out yet.
But in South Carolina, Catherine Gouge was thrilled to reopen her boutique.
We're excited to be open again. We're excited to have some other options of how we can allow people to shop.
But out west, the mayor of Las Vegas raising eyebrows with her push to open casinos and businesses, but offering no plan for doing that safely.
And so for a restaurant to be open or a small boutique to be open, they better figure it out. That's their job. That's not the mayor's job.
California's Governor Gavin Newsom firmly closing the door on reopening large sectors of the economy.
We're not prepared to do that today.
And today, California revealing startling new information about the spread of COVID-19 in the U.S. Authorities have determined 2 people in Santa Clara died in their homes from coronavirus on February 6th and 17th, weeks before the first reported American death. Neither person had traveled overseas, raising new questions about just how long the virus has been on our shores.
Well, we've actually directed beyond just Santa Clara, go back as far as December, to request coroner's autopsy to dig even deeper.
Governor Newsom there, with Johnson with us again tonight, and with the president making news just moments ago, acknowledging he's talked with Georgia's governor. The president said he talked about cautioning the governor against opening too quickly here. And you've also got news tonight from Governor Cuomo.
Yeah, David, President Trump said that he disagrees strongly with what Georgia was doing moving forward without meeting those federal guidelines from the White House Coronavirus Task Force. We're still hearing more from the president on that. But meantime, Governor Cuomo says he wants to double the testing capacity in this state. It's at 20,000 now. He wants it to be 40,000. And he said that President Trump, in their meeting at the White House yesterday, agreed to use the powers of the federal government to help get labs the testing supplies they need. David.
All right, navigating these weeks and months ahead. Whit Johnson, thanks to you again tonight. And as we reported at the top here, a doctor at the Department of Health and Human Services tonight, he'd been helping to lead the fight to develop a vaccine. He now says he's been removed from his post, he says, because he spoke up about drugs not backed by science, including hydroxychloroquine. Here's Terry Moran tonight.
Tonight, Dr. Rick Bright, who led the key federal agency that's developing drugs and a vaccine to fight the coronavirus, is suddenly out of his job, and he's speaking out. Bright says he was abruptly removed from his post this week because, he claims, he insisted on rigorous science-based vetting of hydroxychloroquine, the anti-malaria drug that's been embraced by President Trump.
I think it could be something really incredible. We're having some very good things happening with it.
Dr. Bright, in a statement he released after being transferred to another agency, declared, "I am speaking out because to combat this deadly virus, science, not politics or cronyism, has to lead the way." Bright says he defied directives to push the anti-malaria drug, saying it was being promoted by the administration as a panacea, but clearly lacks scientific merit. The Veterans Administration tried it on COVID-19 patients, and researchers say it may lead to a higher death rate. Jonathan Karl pressed the president on those new findings.
A panel of experts at the NIH is actually now recommending against the use of hydroxychloroquine in combination with Z-Pak, which is something you've
we'll
been
take a look at
recommending.
that. I'm always willing to take a look. Brett?
Trump and his allies have hyped the drug repeatedly to the apparent dismay of Dr. Anthony Fauci, who's called the evidence for its use anecdotal. And when Fauci tried to answer a question from a reporter earlier this month, he was pushed aside by the president.
Correct?
He's answered that question 15 times.
So let's bring in Terry Moran live from Washington tonight. And Terry, this doctor is now calling for an investigation.
That's right, David. Dr. Bright is asking the Inspector General of the Department of Health and Human Services to investigate what the doctor says is, quote, the politicization of work on medicines and a vaccine for the coronavirus. And the doctor's also hired lawyers, the same lawyers who represented Dr. Christine Blasey Ford, Justice Brett Kavanaugh's accuser. They say that his removal from that post was, quote, retaliation, plain and simple, and they want to see him reinstated. David?
All right, Terry, thank you. There are real concerns about the food lines growing in this country. I mentioned that veteran, a father of three, waiting in 2 lines today and still not getting any food to put on the table. And the virus and the growing impact on the food supply now. Tyson Foods suspending operations at one of the largest meat processing plants in the country. Nearly 200 infections linked to that one facility alone. Here again tonight, Matt Gutman.
They're crammed tonight, bumper to bumper, from Ohio to West Palm Beach.
2 hours in line, and they're not giving food yet.
In March alone, food banks nationwide distributed more than 379 million meals, a 20% jump. Feeding America predicting 54 million people could go hungry due to the pandemic, including 18 million children. Don Hayden, a disabled veteran in Florida, waiting in 2 lines.
By the time I got to the front of the lines after waiting for hours, our family was unable to get any food.
And tonight, with millions of Americans struggling to put food on the table.
I never imagined that I would be in this state, ever, never.
Food processing plants are struggling to get food to them, with 51 COVID-related closures just in one part of the Midwest, and coronavirus outbreaks reported in meatpacking plants in at least 10 states. Tyson Foods tonight shuttering one of the country's biggest pork plants, nearly 200 employees testing positive for the virus. The nation's biggest outbreak remains at the Smithfield pork plant in South Dakota. More than 780 infected. Michael Goutlek, working the line, says some employees used hairnets as masks.
It's the balaclava type that you put on your head like a mask and covers your face and your nose.
Michael later tested positive. Smithfield tells ABC News tonight it has followed CDC guidelines and is doing everything in our power to help protect our team members from COVID-19 in the workplace.
We're thinking about all of those workers, of course. Matt with us now live from a farm in South Dakota. And Matt, we've been reporting here on those images of unused food, milk being dumped. Farmers really with no choice because all of this is spoiling. And we said we would stay on this. And you've got news tonight from one supermarket chain now working to get some of that produce to families who need it.
Yeah, the public supermarket chain, David, says it's got a new initiative rolling out. It's going to buy fresh produce and milk from those farmers and then donate it to Feeding America food banks across 7 states. Now, there's one thing that food producers across the country want us all to know: not to expect any food shortages anytime soon. David.
Right, Matt, our thanks to you again. And I know so many of you at home have been asking us, are there ways to help if you're able? We still do have that information up for you. You can also go to feedingamerica.org after our series of reports right here. In the meantime, tonight, the first large study in the U.S. now revealing which COVID-19 patients are hardest hit. Researchers discovering men in every age group dying more than women, and what the data shows about hospitalized patients who also have high blood pressure, obesity, and diabetes. Here's Steve Osunsami.
American doctors are getting good information tonight on who is hurt the most after getting sick with the coronavirus. And it's patients like Sean Evans in suburban Atlanta. He's a diabetic, and after coming down with COVID-19, he now needs a new kidney and regular dialysis.
Just so people know, this is kind of the way I take dialysis right now. This is a port in my chest that goes directly to my heart.
The study published today looked at 5,700 sick patients and found that nearly 57% were already struggling with high blood pressure, nearly 42% were dealing with obesity, and nearly 34% were diabetic. They also found that men were more likely to die. Harold Jenkins came close to dying in a South Georgia hospital and was on a ventilator in the ICU. He is also diabetic.
I've seen a lot of things.
I'm a Vietnam veteran, you know, I've done a lot of things. And this pandemic is something else.
Scientists believe that COVID-19 targets blood vessels, so patients with pulmonary damage from high blood pressure, for example, could suffer more. There was hope that the malaria drug, hydroxychloroquine, might help treat sick patients, but the early results are disappointing. What's showing promise are blood plasma infusions from people who've already beaten the virus and a drug called remdesivir, which was originally made to treat Ebola. Chris Kane says it's the drug that saved his life.
Within 48 hours, I was feeling a lot better. I think that remdesivir gave the extra jump start or kick start or whatever I needed to kind of turn that corner.
Clinical trials are now underway for those two treatments, and while the final results are not yet in, the early results are positive. David?
And that is good news, Steve. Thank you. Much more about the mystery of the coronavirus and the doctors trying to unravel it. That's later tonight right here on Nightline. Meantime, overseas tonight, countries trying to reopen, and Sweden, one country that took a very different approach from the start. So did it work? James Longman from Stockholm.
Tonight, Sweden's death toll may be rising, but its alternative lockdown still has support.
You're still sitting outside, you're still enjoying a beer. You know they can't do this in most parts of Europe and America.
I know that we stand out in the world, and I'm glad for it because I support our strategy.
They call it a voluntary lockdown. Social distancing advised, but bars, shops, cafes and restaurants all open. About a third of Stockholm's population, 600,000, expected to have had the virus by May 1st. The hope is for some kind of broad immunity, a second wave less of a threat. But Sweden's approach does seem to come at a higher cost than its neighbours. All have lower deaths per capita. And these half measures are leaving some businesses guessing.
Sometimes I wish the government would just say total shutdown, and I'm like, okay, that's fine. I can't do anything about it.
We have to find a way to have a new kind of normal, because this will last for a long time.
Some US protesters have adopted Sweden as an example, but the health minister here says it's not for everyone.
We have a strategy, and we think it's working here in Sweden. I don't think it's easy or right to just export the strategies from different countries.
And Sweden may be experimenting, but worrying news out of the UK tonight, David. Deaths in nursing homes have gone uncounted so far, but may soon add thousands to Britain's toll, which is already at 18,000. David?
All right, James Longman from Stockholm. James, thank you. And when we come back, Dr. Jen Ashton on that new data, who is most at risk in this country? And news tonight, 2 pets testing positive.
What do you look for when you trade?
I want free access to research.
Yep, TD Ameritrade's got that.
Free access to every platform.
Yeah, that too.
I don't want any trade minimums.
Yeah, I totally agree. They don't have any of those.
I want to know what I'm paying up front.
Yes, absolutely.
Do you just say yes to every